So we're pretty much going over like substance use, whether it be medications your doctor's giving you, whether it's stuff you get from friends, family, whether it's illegal, legal, it's kind of a wide variety. The point of doing it, we have a couple goals. One is to introduce ourselves to people within our community and kind of have a connection. Two is for you to know the safety of what you come in contact with or people that your friends or family with, so that in case an emergency or something happens, you know what to do. And then you can kind of see where using or abusing some of these things can also lead to issues within your personal life, your employment life, and stuff like that. So those are our goals for you. It's just to share our information so it educates everybody a little bit more, because we always try to say that better knowledge means a better you, just meaning the more you know, the more you're able to make better choices. Everybody in agreement to that? Okay. So just a raise of your hands, whether you've used or abused, or whether you have family that's used or abused. Is there anybody that isn't affected by this somewhere? I think it kind of affects everybody. I can tell you, I've had family members, and they've also been in facilities where they were homeless and they couldn't kind of get over spells and stuff. So sometimes it's just it's a cycle. So we just want to try to educate, try to help any way we can, okay? All right, so first, what is a drug? A drug is just any substance that's absorbed in the body. It could be alcohol, it could be a prescription medication for your blood pressure, it could be something for anxiety, something for pain. A drug is just anything that alters your physical thoughts or how your body naturally functions. The good news is if you have used any drug, it is preventable. And if you're addicted to any drug, it is treatable. So abuse of a drug is a healthy problem many face today. Healthy problems impair your family life, your productive employment, diminish the quality of your life, and it can even threaten your survival. So we're going to go ahead and move on to each person kind of pick the topic that they wanted to discuss. So we'll let it kind of just go as a flow and everybody kind of discuss different items.
The first topic is going to be discussing alcohol use disorder. Alcohol use disorder is characterized by uncontrolled physical and emotional dependence on alcohol. It can include periods of alcohol intoxication and symptoms of withdrawal. Symptoms include a strong desire to use alcohol. People that suffer from alcohol use disorder have problems controlling their drinking habits and have withdrawal symptoms if they abruptly stop or decrease drinking. Sometimes medication detoxification is needed to stop drinking safely. Recognizing the signs. If you or a loved one has experienced two or more of these criteria within the last 12 months, it may point to a problematic pattern of alcohol abuse that could benefit from treatment. And so this is like a questionnaire that helps people to know if they have a problem with alcohol. If you have the inability to cut down or control your alcohol consumption following persistent attempts to quit, a craving or a strong desire to use alcohol. Limiting the time of alcohol consumption during drinking sessions becomes more and more difficult. A great deal of time is spent doing activities that involve drinking alcohol or recovering from its effects. Job or school performance may suffer due to the after effects of drinking or being intoxicated. Continued issues with interpersonal relationships caused or exacerbated by alcohol. Child care or household responsibilities may be neglected. Continued use of alcohol in situations in which it is physically hazardous, for example, maybe driving. A growing tolerance in which increased amounts of alcohol are needed to achieve intoxication or the desired effect. Alcohol use leads to giving up important occupational, social, or recreational activities, experiencing symptoms of withdrawal and abstaining from alcohol. Treatment options. Treatment may be outpatient or inpatient depending on the client needs. Treatment programs will include specialty programs consisting of a therapist and or counselors. Clients can participate in talk therapy or mutual support groups. There are also medication options available that will be prescribed to you by your doctor or licensed therapist. The road to recovery. Many do recover from alcohol use disorder, but the road is not an easy one. seeking professional help early on and avoiding triggers such as stress or being around other drinkers can aid in preventing relapse. Hotline information. There are several hotline options available, such as alcoholrehab.org, and then it's a phone number to a 24-hour hotline. The William J. McCord Adolescent Treatment Facility, which is here in Orangeburg on Cook Road. They have alcohol treatment options available as well.
Yes.
Let's say you do have a friend that suffers from alcoholism. How can you be a support to them if you are facing or dealing with things yourself? Because I feel like you can't really say something because you got your own stuff going on, but you see destruction is within your brain.
Can I put that in terms?
Oh,
How can you help an alcoholic if you're using drugs yourself?
So pretty much, with any abuse of any substance, everyone's underlying reason is going to be different. But one thing is in common is usually related to some type of stress, whether it's something you're going through currently or something you've had done in the past. It's usually some type of stress within you that leads you to do those things because it kind of puts you out of your current situation. Whether it be mentally, you're just like, more sleepy or more happy or more carefree or, having a great time and don't really think about the bad stuff. Just sometimes, stress is always going to be an indicator. So the best help you can give anybody is try to be that positive thing in their life and don't be more stressed to them. Don't argue, don't add more burden to them, don't overwhelm them. Just try to support and then try not to be an increased stress with that person.
I think a big thing too is, trying not to come off as being judgmental to each other. You know what I'm saying? You both can work on it together.
Thanks.
Alright, mine's gonna be on methamphetamines or meth. And I'm just gonna tell you how it's used, what it does to your body, short term, long term, and then where you can also go locally for treatment. So meth, also known as ice, chalk, or speed, for other names. This is used orally, smoked, sorted, or dissolved in water, alcohol, and then injected. It produces an intense feeling and meth pleasure fades quickly, so users take repeated doses in a binge and crash pattern. That's why it's so addictive. It alters brain function and leads to repetitive drug-seeking behavior. So how it's so addicting, it affects the chemicals in your brain, especially dopamine. Dopamine's the reward and motivation chemical in the brain. And so what that does, it gives you that big rush or flash and it increases that dopamine level. So that's why you get so addicted very quickly to it compared to other drugs. Addictions occurs quickly. So you'll start seeing the person have severe anxiety, confusion, memory loss, violent behavior outbursts, like reduced hand and eye coordination, foot coordination. Short-term effects on meth on the body are decreased appetite, increased energy, nausea, hallucinations, seizures, or rapid or regular heartbeats. Long-term effects of meth on the body would be for the mouth, oral, or any digestive system would be tooth decay, increased acid in the stomach and mouth. You will have a dry mouth, poor diet, teeth grinding, tooth loss. It can also cause kidney damage or kidney failure. You can get hepatitis from using needles, so you'll get hepatitis C from that. The lungs, it can cause pulmonary edema or constriction of your blood vessels, so it makes it harder on you to breathe. For the heart, it affects the heart rate, and it can cause stroke, blood clots in the body. Also, it causes accelerated aging. Some overdose symptoms are trouble breathing, signs of a heart attack or stroke, such as chest pain or confusion. It can cause high or low blood pressure. It increases the body temperature. It causes intense stomach pain and a lot of paranoia. So treatment of the overdose is mainly Benzodiazepines, the first line of treatment. You'll do a lot of vital sign monitoring and then supportive breathing for that. So call 911 or get Narcan is what they'll do. So if you do have an overdose, and then some local rehabs for it around the Orangeburg area is the Dawn Center, and then also the Peaceful Opioid Rehab in Orangeburg as well.
Where is that located?
What is it?
It's called
Peaceful.
Opioid Rehab in Orangeburg, 927 Chestnut Street.
We're gonna leave, we'll leave our information with you, cause it has like some good websites, good phone numbers that are also good resources for you. And sometimes so much information is hard to hold and retain, and then when you're around other people, sometimes that's not your best learning time. So we're gonna leave a copy of everything, that way you can kinda come back at your time.
Explaining a whole lot too.
Yeah.
So before I begin, how many people have used marijuana or know somebody that uses marijuana?
Honest, but they everybody else raise their hands. Come on,
I
now.
haven't used marijuana. We're not here judging. It just kinda gives us an idea of how much
You know,
information.
be honest with this building.
I haven't touched it since I was like 15.
Yeah.
I never saw it point.
Yeah.
Okay, relax, relax, and eat. But you know, white one, a nice person to be around.
Okay, now she's about to tell us the bad stuff.
All right, y'all.
Okay, so marijuana or cannabis is leaves or flowers that contain tetrahydrocannabinol or THC. It is commonly smoked out of cigars or cigarettes on joint. Or you could also smoke the extract on the marijuana oils or resin can be extracted to make various forms, even allowing the use of vape pen. In addition to smoking marijuana, it's also consumed by eating it. Marijuana is one of the most used substances in the United States. Marijuana is the most commonly used illegal drug and is the fourth most common psychoactive drug used in the United States after caffeine, alcohol, and nicotine. Marijuana is also considered the most addictive drug after tobacco and alcohol, according to the National Institute on Drug Abuse. Marijuana can be mixed with tobacco and other substances to increase the effects of being high. As previously mentioned, marijuana can be smoked out of cigars and cigarette papers and also be consumed in food after being productive. According to the National Institute of Drug Abuse, the effects of eating marijuana are seen more slowly than what it is when smoking. And it usually takes about 30 minutes to an hour to set into effect. But marijuana has both short and long-term effects, including physical effects on the body as well as mental effects. So some of the physical effects that you can see when consuming marijuana include breathing problems due to the irritation from the smoke. Users of marijuana can also see an increased heart rate that can be seen up to 3 hours after smoking, which may put individuals with heart problems at higher risk for adverse effects of the condition. Intense nausea and vomiting can lead to caffeine-related hyperemesis syndrome that is seen in long-term users, and they experience severe nausea, vomiting, dehydration cycles that may sometimes cause the user to seek medical attention.
Is that when you add something to marijuana? It got to be there.
It really depends on the person. You have to kind of remember that everything you put in your body is going to affect every person a different way, because it's based on your chemical makeup.
Right.
So some things are going to do, say, marijuana might make some people happy and good to eat. Some people say it puts them to sleep. It just does different things to different people.
It does all that.
Certain pieces of it, so it just really depends on the person.
I'm gonna take
Yeah, that's a good question.
So, administration and other effects of marijuana could include bronchial asthma, bronchitis, emphysema, which is a condition that leads to breathlessness, and the extended use of marijuana could result in a decrease in your immune system. So, as I said earlier, there's some short-term and some long-term effects. Some short-term effects that can be seen after consuming marijuana include altered sense such as seeing brighter colors, seeing new details of everyday things, and time seems to move slower. Individual may also experience conjunctival injection, which is red eyes, from heat, blood vessel dilation. Other effects that can be seen include changes in mood, impaired body movements, impaired memory, and others. Some effects that can be seen when a person consumes high doses of marijuana include hallucinations, delusions, and psychosis. According to the Department of Justice, the Drug Enforcement Administration, common responses to marijuana include dizziness, nausea, increased heart rate, emotional changes, heightened sensitivity, and much more. So long-term effects of marijuana that can be seen after consuming marijuana include a possible loss of IQ points in children, but have not seen as much in adults. So, marijuana withdrawal. Marijuana withdrawal symptoms occur after about a week of cessation. Symptoms that may be seen with the withdrawal include irritability, anger, aggression, anxiety, restlessness, and depression. A person may also experience withdrawal symptoms that include grouchiness and craving. Sleepiness is also a withdrawal symptom that may occur, and individuals may also experience disturbing dreams and insomnia as well during withdrawal. So treatments for marijuana. Marijuana has many effects on a person's life, which may include a lower life satisfaction, poor mental health, poor physical health, and more relationship problems. Some effects may cause the individual to seek help. While there are research underway to help find a way with marijuana withdrawal, there is currently no medications to treat marijuana disorder. While there are no medications available for withdrawal, anti-anxiety medication or antidepressant medications may be prescribed. Individuals may also need to be hospitalized or have outpatient care, and individual, family, and group therapy can provide support throughout the entire withdrawal period.
But I thought marijuana helped with anxiety more.
It can help with anxiety, but at the same time, it can still leading causes.
The thing is when you stop using it, is where your anxiety and stuff also comes in. You know, any chemical again you put in your body, it kind of overtakes what you naturally do. So whether you're a happy person naturally or not a happy person naturally, is why it's going to affect people differently, because it's according to your chemical level of how it's going to affect you.
Yeah, that's some real good. Dang,
Alright, so I'm Savannah, and I chose opioids. Anybody know what opioids are? So it's things like pain medicine, heroin, you know, and a lot of times people can't help the addiction because it only takes 3 days to get addicted to pain pills. And that could be prescribed to you. And I mean, it just kind of depends on you as a person, genetics, all that stuff. But, you know, it's a very, very hard cycle, you know, to go through. As a family member, I have people in my family who are addicted to opioids, and I've watched people struggle with it, and it's very hard to beat, but it is possible. So I'm going to just tell y'all a little bit about it. So the risks are greater with people with a history of drug misuse or substance use disorder or overdose, people with mental health, like conditions like depression or anxiety, sleep apnea, people over 65, people who are pregnant. So there's a lot of things you can do with your providers if you might think you're at risk for an opioid addiction. So you can tell them you would rather have pain relievers such as acetaminophen, ibuprofen, naproxen, medications that are used for depression or seizures, physical therapy and exercise, cognitive behavioral therapy, which would have a less risk of you being addicted to opioids. And a lot of times the opioid pain prescription medication addiction turns into a heroin addiction because people can't afford to buy the pain pills off the street, and heroin is a cheaper drug than the pain. So we are currently in an opioid epidemic, and nearly 130 people die each day from opioid drug-related overdose. They can affect your brain and cause dependence in little to 3 days. So you have to be very, very careful, especially, you know, if you've already been struggling with some type of addiction. Approximately 10.1 million people aged 12 and older misused opioids in 2019.
So awareness is crucial in taking down this crisis. So if you or a loved one or someone you know need to reach out for help, there are many available resources. Addiction is a disease, but remember there are cures and there is hope for anyone you may know, family, friends, you yourself, anyone. So I have a lot of phone numbers in here that some is related to like South Carolina, near here, South Carolina Hope. It's a 24/7 support line that will connect you with a substance abuse licensed addiction counselor or a peer support specialist. There's also the U.S. Department of Health and Human Services hotline, and there's another hotline I have listed on here. Also, there is a website, I'm not sure if it's on here, but it's called justplainkillers.com, and that's somewhere where you can find Narcan. So if you know someone with this addiction, that is a very, very important thing to know where that is, because it could save somebody's life from overdose. Thank you.
And while she's talking about Narcan, she mentioned Narcan. I have Narcan, but Dawn Center is gives it to you free, but they also give you a free training on how to use it. Because you can use it the wrong way. We had someone here before and basically had to use Narcan on them. So that is a great resource at the Dawn Center, that they do give that training on how to use it. Because if you use it wrong, you just add it to the issue.
Yeah, later, like I said, we'll leave a copy because they have some really good information. But like the kits actually come with like, I call it like a dummy proof instruction, because it kind of goes one, what do you do first, second, third, and then that way you know have a little resource if you've never used it before how to do it. So most of the kits are a little user friendly on trying to teach layman people how to use it. Yeah.
So that's legal to use on anybody?
Anybody that you think is experiencing an overdose.
And it's free too.
Yeah.
It's free. So I mean, if you
Yeah.
know someone who is, that's a very, very important
What's
thing.
the sign for like overdose?
Usually, most of the time, you'll see that they're almost unconscious or they're barely breathing, because opioids just slow your respirations down. So most of the time, they're usually slumped over, they're usually unconscious and not answering you. But you'll also notice they're barely breathing. At some point when you find them, they're already not breathing. So it's not going to hurt them. It can maybe help them. No, they don't have to be, because you try to breathe. If you've ever kind of counted your breaths, most people are about 12 to 18 times they breathe in 1 minute. Once you take these medicines to an unsafe level, you're very, like you might see them, and then like it'll be a long time before you see them breathe again.
Okay,
So, yeah.
So some people can be like this, in a hard deep sleep, and you think that.
But their rate is usually at a safe rate. But when that rate is just so slow that you're not taking in enough oxygen to keep you alive, that's when they start to go unconscious. So
I think I also have a diagram on there that tells you, the side effects and everything, if y'all would like to go through it.
Yeah. All right, our last topic are benzodiazepines. They're things like your Xanax, your Ativan, Valium. Those are kind of some of the more popular names. A lot of people, they start usually with their physician, their doctor. Life is stressful. Life can feel overwhelming sometimes, especially when you don't have a job or you have a bunch of responsibility on you, or you're homeless, or you just got stressors going on. And sometimes you just say, okay, I just cannot handle this anymore. I just can't take it. Feels like my heart's racing. I just can't breathe. I'm stressed out. And you go to your doctor and say, is there anything you can do to help me? Well, of course they're going to give you one of these because that's what it is used for. But you have to use it as prescribed and only when needed, instead of getting in a habit of controlling how you feel with just medicine. You got to also learn those coping skills to try to say, okay, don't take on more than I can handle. And if there's people in my life that are stressing me out, I got to distance myself from those people. If there's things I need to do, whether it's take a walk, draw, listen to music, dance, play a game, read a book, you've got to go to a more healthier choice to try to deactivate your brain from overload. So those are some of the most popular ones. Some of the signs of addiction and how it affects you physically. is you'll get where you can't sleep without taking that medicine. Like, you physically become addicted to it. You have memory loss, you're dizzy because it alters you down, it slows you down. That's what it does. Depression, aggression, when you can't get it, you start firing off and you feel like you're going 1,000 miles a minute. The withdrawal timeline on it, so if you take some of these medications, usually about 6 to 12 hours later, it's done out your system. So of course you want some more. Within about 2 weeks, you'll kind of see that they start to subside out your system, but you're still craving them. They can stay in your system from anywhere to months or years, that drive to want to get more. So it's not a quick fix. It's something you need to taper yourself down. If, say, you were already taking 10 pills a day, then you need to go to 5 pills a day, 6 pills a day, and kind of slowly wean yourself down, because your body needs to say, okay, let me go from here to here, but you can't go from here to here the same day, because that's when you're going to feel even worse. So you kind of need to just self-monitor yourself and get yourself off of them and try other alternatives. So some of the side effects from doing these medicines, it does slow your reaction time, so that will affect your work, you're driving a vehicle, anything like that will be affected. It will slow your speech, you will have slurred speech, you will be drowsy, dizzy. It can slow your stomach, so you're going to become constipated. You can become aggressive or depressed, because that's how the chemicals are making you feel when they start shifting. And it can also cause hallucinations and paranoia. So some pretty serious side effects. Some coping skills, like I said, try to do some emotional things. Get a support system. You know, it's hard to do things by yourself. So if you can find someone positive in your life that's in your corner, you know, really that's going to aid in you trying to help yourself. Some common coping mechanisms, like I said, lower your expectations, ask for help. There's nothing wrong with asking for help. Use your community resources that are available for any type of substance abuse. Maintain your emotional composure. De-stress your life. Distance yourself from anybody who's not healthy for you. So pretty much our goal was just to give you a wide spectrum of different substances that are usually abused and the negative aspects of what it can do to your life. We want to educate you so you can have that knowledge to try to either help yourself or help someone you know that's going through the same thing. Because in the end, it may be a short fix to what you're going through, but in the long run, it ends up usually causing more problems. So is there any questions on any of the substance or anything we can maybe answer? No? Do you guys have anything else to say?
Thank y'all for y'all's time.
What do we say?
Thank you. You're welcome.
Thank you.
Thank you.
That's what they
Do y'all do you want us to leave this here or do you want to take it?
Oh.
Yes, ma'am. All right, thank you so much.
And I'm trying to get, I mean, just so they made, because I was